here is your question. Yes. Right. So if you have read and understood, considering it surgical anatomy station, kindly please tell me how would you, yes, how would you divide the triangles of the neck? Excuse me.
The triangle of the neck is divided the anterior triangle and the posterior triangle by the
Yes.
sternocleidoid mastoid muscle.
Yes.
The anterior triangle boundaries is the angle of the mandible, is the base, and the posterior border is the sternocleidomastoid muscle,
Yes.
and the anterior border is the midline of the neck.
Okay.
The posterior
As you
triangle,
can see, how many triangles there are in the interior triangle. If you subdivide, which muscle is this? If you can identify number one, please.
This is posterior view of the gastric.
Okay, please. Can you identify, would you be able to identify the number of triangles? Which triangle is number 13?
Submandibular triangle.
Very good. What are the contents of this triangle and what are the boundaries?
Submandibular gland, hypoglossal nerve,
Very
mylohyoid
good.
muscle.
Very good. Excellent. Okay, can you please identify this triangle, number 10? Yes.
Carotid triangle.
2, sorry.
The 10 is the hyoid muscle.
Hyoid
Hyoid bone.
muscle. This is 2, I'm sorry. This is triangle.
This is the
This is
carotid
number
triangle.
2. Very good. If you can identify number 8, please.
Muscular triangle.
Okay. Right. If you can identify number 7, it is part of, yes, posterior triangle.
Suboccipital triangle
Okay.
or posterior triangle.
How many, this posterior triangle is divided into how many small triangles?
2.
2. By which muscle? What is this number 5?
Posterior pelvic omohyoid.
Very good. Okay. Right. We'll move on. If you can identify number E, please.
Thyroid gland.
Yes, thyroid gland. What is the anatomy of the thyroid gland? If you can tell me how many parts it has.
Formed of 2 lobes and the isthmus and the pyramidal lobe.
Yes, the E is isthmus, right?
Yeah, the isthmus of
So
thyroid
it has 2. All right. Can you tell me the blood supply of the thyroid gland? So blood supply, arterial and venous both.
Okay, arterial supply. The arterial supply of the thyroid gland, superior thyroid artery from the external carotid artery, middle inferior thyroid artery from the subclavian first part of the subclavian artery, thyrocervical trunk.
Yes.
And the thyroidema artery from the aorta or brachiocephalic artery.
Yes.
Also the venous supply, superior thyroid vein, and the middle thyroid vein, which drain into internal jugular vein, and the inferior thyroid vein, which is drain into the brachiocephalic vein, left brachiocephalic vein. The lymph node drainage is from the prelaryngeal, pretracheal, paratracheal, and upper and deep cervical lymph node. All
right. Can you tell me what does the recurrent laryngeal nerve supplies?
By all laryngeal muscle except the cricothyroid muscle.
Which is supplied by?
Which is supplied by the external laryngeal muscle. External laryngeal nerve.
Very good. Can you tell me, while you are doing or performing thyroidectomy, which nerves are at risk of damage?
Okay, yes. When dealing with superior thyroid artery, the external laryngeal nerve is in danger. When we was dealing with the inferior thyroid artery, the recurrent laryngeal nerve is in danger.
Very good. Can you please tell me the embryology of the thyroid gland? How the thyroglossal cyst is formed?
Thyroglossal cyst is formed due to incomplete closure of thyroglossal duct.
Very
thyroglossus
good. Yes.
tract.
Yes. Which occurs where?
From the following,
Develops.
which
Yeah.
with the following sequence from the posterior to third of the tongue.
Yes. And then it passes. If you can tell me the whole.
Yes, then it passes this passes from the tongue down to loop around the hyoid bone.
Yes. Around the hyoid bone. Yes. All right. Okay. If you can tell me, this thyroid cartilage would be present at what vertebral level?
Thyroid C4.
Yes, between C4 and C5. Okay. Can you tell me what might be the reason when you are swallowing or deglutition, thyroid moves?
As the thyroid gland is attached to the pretracheal fascia, which also attached to the hyoid bone. When the digastric muscle contracts during swallowing, it will attach, or it will move the pretracheal fascia, which is also attached to the thyroid gland. So with swallowing, the both mobile with the swallowing.
All right, thank you. Can you tell me, can you please tell me what is the most commonly occurring thyroid carcinoma?
Papillothyroid carcinoma.
What is the mode of spread of this carcinoma?
A lymphatic spread.
All right, good, thank you. Can you tell me, can you name few early and late complications of thyroidectomy, please?
Early complication of the thyroidectomy?
Yes, post-thyroidectomy. What are the early and the late complications, if you can name few?
Early complication of thyroidectomy, hematoma, serous
Yes,
formation,
yes.
serous formation, hypocalcemia.
Okay, and late complications?
Maybe hypothyroidism.
Okay, and
hypoparathyroidism. Hypocalcemia due to hypoparathyroidism.
Late could even be the nerve injury, etc.
Sorry?
Yes. Nerve injuries can also come into late complications, or because you wouldn't know at that time until.
Okay, yes, yes.
All right. Can you please tell me what is Frey syndrome?
Frey syndrome?
Frey syndrome, yes.
Yes, it's
and when does it occur?
Apparent regeneration of parasympathetic fibers due to sorry.
All right, we'll come back to this question later. Can you identify on this? This is the just suppose it's an human neck. If you can identify or tell me the surface anatomy of the thyroid gland. Can you see it drawn over here? So if you can tell me the surface anatomy.
We can you skip this question for now?
Okay, all right. Can you please tell me if you can identify, number red, this red one, which vessel is this?
Carotid artery.
Okay. If you can identify this blue, 11.
Geography.
What are the tributaries? How is it formed? At what level? If you can tell me the surface anatomy.
Sorry?
If you can tell me the surface anatomy, where is it formed and how is what are the tributaries which form it?
Internal jugular vein is formed by
at what level, please?
Can you skip this question?
Okay. Yes, sure, we can. Yes, that was it. So if you can tell me about the parotid gland, what are the structures which pass through the superficial, which pass through the parotid gland from superficial to deep?
External carotid artery, which is branch to maxillary artery, so superficial temporal artery.
Yes, and what branches of the facial nerve? Yes.
Facial nerve and its branches.
Yes. And
retromandibular vein.
Very good. Yes. And auriculotemporal nerve as well.
Auriculotemporal nerve, yes.
And lymph nodes, lymph vessels. Okay. What kind of fluid or what kind of secretion parotid gland secretes?
Serous fluid.
Very good. All right. Last question. Tell me few differential diagnoses of parotid gland or parotid lump.
Parotid lump, maybe infection, acute parotitis, maybe tumor, which is maybe benign polymorphic adenoma, Warthin tumor, or malignant.
Very good. Excellent. Yes. All right, good. Thank you.
Thank you.